Humanity sets the agenda.
8 minutes past 11, you are listening to the Mid-Morning Talk on Salam Media with me, Mari Makwanda. So we've dealt a lot with the kidneys here on the show on our health segment with Urologist Dr Salim Choonara, and he's back once again to talk about kidney infection and how you can spot the symptoms. Kidney infection is a type of urinary tract infection, or UTI. I'm sure you are familiar with UTI since we have spoken about it before. It's a infection that commonly begins in your bladder and moves upstream to one or both of your kidneys. Dr. Salim is on the other side of the stream to tell us more. Assalamu alaikum wa rahmatullahi wa barakatuh, Dr. Salim Choonara, and shukran for joining me once again.
Walaikum salam wa rahmatullah, Mariam, and to your viewers and listeners as well. And I hope you had a good Ramadan and Eid as well. Thank you.
Alhamdulillah, it was a lovely one, even though we had some members in the hospital. But Alhamdulillah, it was all worth it. I hope you had a good one too. But the show must go on, and today we are talking kidney infection. I know we've previously dealt with UTIs, but what is a kidney infection, and what are the main causes of it?
Thanks, Mariam. So, as you correctly pointed out in your introduction, the kidney infection is a part of what we would call a urinary tract infection. It's just that the location where the infection occurs will determine the name we would use to describe that infection. So, for example, let's say it involves a bladder, it would be called a cystitis. If it involves a urethra, called a urethritis. So, the reference to the kidney here is, I'm sure people have heard this term called pyelonephritis. Pyelonephritis. So, that refers to where the infection is in the kidney. So, as you indicated, one of the commonest reasons for that to occur is if there's an infection in the bladder and perhaps maybe untreated or perhaps not completely treated, and it can spread upstream to involve the kidney, in which case the infection will then now start sort of affecting the kidney itself. Apart from that, there are other risk factors that can lead to that situation occurring. Commonly, we see this in patients who are diabetic. They certainly are at higher risk for developing complications following a simple infection that may not be adequately treated and can proceed or progress to what we call a pyelonephritis. The other sort of big group in this area would be those individuals that have some sort of anatomical or structural abnormality with the urinary tract. And by this, what I mean by this is that they could be having, for example, things like the previous history of stones, or stones in the kidney or stones in the bladder. They may have some abnormality with the tubes that connect the kidney to the bladder. There may be a stricture there, there may be a narrowing there, maybe some anatomical defect that predisposes them to developing an infection in the kidney. It could be abnormalities with the kidney itself. Sometimes we get sort of duplex kidneys or an abnormal shape of the kidney, or previous infections which has led to scar tissue affecting the function of the kidney, and as I said, led to things like calcifications or stones, which can further sort of enhance that risk for where somebody would develop a kidney infection. Also, individuals that have previous injuries to the kidney, damage to sort of the collecting system or the kidney structure, where the anatomy, where the structure has been somewhat altered, somewhat affected, the function somewhat impaired. They also would be at risk for developing things like kidney infections. The bigger group also would be like your immunocompromised patients, even cancer patients. Other immunocompromised individuals are also at risk for developing pyelonephritis or kidney infections. And then the other group in that discussion would be the pediatric group, would be children, especially again those with anatomical abnormalities, especially things like a reflux, where reflux refers to where the urine sort of refluxes from the bladder up towards the kidney. So they could also be at risk for developing infection of the kidney, especially if they are prone to developing bladder infections. Because remember, naturally there's a barrier to that happen. In other words, if there's an infection in the bladder, there's a natural barrier, natural type of valve system that prevents the urine from tracking from the bladder up to the kidney. But when there's some of these abnormalities, it can interfere with that normal mechanism and that can lead to infections. The other group also where we can see this is in individuals that have difficulty urinating, so something from the outflow, being from the bladder to the external, whether it be bladder neck stricture, whether it be those with very large prostates, or any kind of narrowing or change to the caliber of the outflow, where individuals have difficulty emptying their bladders or urinating. The buildup of pressure in the bladder, urine in the bladder, can also then predispose to where they develop a kidney infection. So I think that's kind of broad overview of the areas that we would look at, in somebody that presents with a pyelonephritis, or as we said, an infection where it's now based in the kidney, or the source is now the kidney.
All right, let's talk about the warning signs and symptoms that we need to be aware of.
Okay, so the more classical symptoms of a pyelonephritis or kidney infection would involve pain, and in this case it would be flank pain. Flank pain, obviously, you put your hand to the side, sort of demarcates the position of the kidney. That would be the area that we're looking at. So flank pain would be a feature. The other things are also, because remember, generally in patients that have like a bladder infection, for example, they're otherwise okay, they feel a little bit off, maybe a bit of abdominal pain, they can take an antibiotic, they feel fine. When it involves the kidney, so pain is a characteristic feature, as well as what we call chills and rigors. People say, I just feel very, very cold, I just want to cover myself, and the body is shaking. That's also one of the features that would suggest that there may be a pyelonephritis or a kidney infection. Then the other things like fevers are also an important sign. We want to look out for that there may be a bit more of a complicated infection rather than just a simple, UTI where the reference is made to the bladder and it resolves. And then obviously, the risk factor. So like for example, us, we would know our patient's history. We've seen him before. They may have some underlying factors, and we know, okay, these patients are probably prone to this. If they get those signs and symptoms, we'd be more alerted, sort of more aware that could be what they're dealing with. But I think by and large, we could just summarize the symptoms: flank pain, chills and rigors, and fever. And also they may have some urinary symptoms like maybe burning, discomfort when passing urine, very offensive type of urinary smell, sort of acidic type of odor. Those are, I would say, more the common type of features that would alert one that there's a bit more of a complicated infection happening rather than a simple UTI that most people get and then they find after 2 or 3 days.
All right, let's take a quick break, but when we return, I'd like to talk about the risk factors associated with a kidney infection and what can happen if it is left untreated. Please stay with us, Doctor.
I've come to appreciate the wisdom and are in trusted treatments like Tib Black Seed. You can find Tib Black Seed at all leading pharmacies or find out more at blackseed.co.za.
There are an estimate of 153 million orphans worldwide. Change their lives by donating towards our Orphan Kind program. For 750 Rand per month, you can be the reason an orphan smiles. Go on, be Orphan Kind. Visit www.pennyappeal.org.za or call 031 1100 573 to find out how you can help save these children's lives. Penny Appeal. Small change, big difference.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness. And every pure diamond becomes a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. Come to us. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and freezer card calculation. Visit us at 534 Ridge Road, Overport, or call 031 208 9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
Prices are high, jobs are scarce, and the coldest days are here. South Africans are facing a bleak winter amidst global economic turmoil and soaring food costs. Keeping warm is an added expense. Let's help South Africa stay warm. Sponsor a blanket at just 90 Rand. Donate online at alimdad.com or call 0861 786 2420 for more information.
Listen to something fresh. Listen to Salam Media, your humanitarian broadcaster.
19 after 11, you are listening to the Mid-Morning Talk on Salam Media. And today we are talking kidney infections with urologist Dr. Salim Choonara. If you have any questions or comments, please leave them in the comments section or send them to us on WhatsApp. The number is 061 766 The lines are now open. You can also give us a call on 010-8802-396. Dr. Choonara, shukran for staying on the line now. The risk factors associated with kidney infection, what are they, and what can happen if it is left untreated?
Okay. So I think the question is a very loaded question, right? So I'm going to try and focus on the more common things so that it gives the listeners and the viewers a bit of a better insight. So let's start with the first one, which I think is a common one, which is kidney stones. So if people have had kidney stones before, are at risk for developing kidney infections, either by way of the fact that they've got stones in the kidney that may be growing with time, especially if they are diabetic and they are exposed to what we call like infected stones. They may be also at risk for developing recurrent infections of the kidney. While on the topic of stones, even those individuals where a stone in the kidney may pass down the tube called the ureter, and it's associated with severe pain. People that have those kind of stones will know they have to come to the casualty almost in the middle of the night. So in the case where the system is not obstructed, if you think about a stone blocking the kidney, urine building up in the kidney, that also puts the kidney at risk now, because now it can't drain that urine. Now the urine is static, it can get infected, and that can also lead to an infection. So that would be another common thing we'd see. And then the other big group are those individuals that have had previous surgery. So in other words, let's say, for example, previous bladder surgery, previous stones that required operation because of a stricture. Those individuals that have difficulty passing urine. And in that group, we can also sort of focus on those that have like underlying neurological issues, like your patients with multiple sclerosis, those with neurological issues where they're unable to empty their bladder as well, or they have to use some kind of device to empty their bladder, maybe a catheter, maybe they're self-catheterizing, or they've got an indwelling catheter. So that's another big group. We commonly see those patients. They develop infections of the bladder. Sometimes they don't have much sensation, they don't pick up the symptoms early on, and then they present much sicker a couple of days down the line, fevers, pain in the kidney, pain in the abdominal area. Again, another big group that's at risk for infection. And then also the pediatric age group, I mentioned early on about what we call reflux, where they're also at risk for developing infection. Also, sort of younger boys, especially with valve disease, they can also be at risk for that kind of infections as well. So I think to summarize that point about risk factors, it will be those individuals that have an underlying abnormality of the urinary tract, or they have been at risk for recurrent bladder infections. That group is also sort of like a more of a risk group, where the infection can potentially progress, or the next time they may be suffering a kidney infection, right? So that's what we commonly see. I must say the other abnormalities, like the major anatomical abnormalities and the major developmental anomalies, they do happen, but they're not the very, very common things. So as I said, I didn't want to go too detailed for the few minutes we have. So just to summarize, that's more the common situation. Now, to answer the question about what would happen if it's untreated, that's a very, very important question, I think, in the context of what we're talking about. Because remember, if you have a bladder infection, for example, you go see your GP, maybe 2 or 3 days antibiotic, you're fine, and the story is over. You may never have that infection again. But a kidney infection is very, very different. If left untreated, it can lead to two major issues. One is the infection can now spread into the bloodstream, you know. So often we talk about things like urosepsis, we talk about things like septicemia, especially when it relates to the kidney, especially in the older age group, patients who are immunocompromised. Again, I say diabetics who are naturally immunocompromised, but certainly they are a big group that can easily complicate. So those patients that are left untreated, that infection can now spread from the source in the kidney, get into the bloodstream, and that can make the patient very, very, very sick, you know. So that's an area that we don't want to enter because they may require a long hospital stay. Some patients have been ICU, they may require ventilation, they may require even dialysis for their kidneys, with a severe compromise to the kidneys as well. So those are things that one doesn't want to mess around with, you know. A kidney infection is something that, you know, you want to make sure you adequately treat it, take the correct advice of your doctor, your clinician, your physician, whoever's treating you in that regard. To the extreme, there are cases again where, especially in patients that have stones and are diabetic, and they develop quite a severe infection of the kidney from what we call gas-forming bacteria, and that's what they develop air into the parenchyma or the structure of the kidney. That's a medical emergency, you know, and most of those patients may end up actually losing the kidney to that extent. You know what I'm saying? So it's not a common situation, but I'm just giving you a sort of a continuum, you know, where if left untreated, where and to what extent it could complicate, and you know what the possible treatment strategies could be to that extent, you know. And those patients are generally very, very sick patients, you know. The risk for significant morbidity and mortality is also pretty high in that age group, you know.
All right, so we do have a question from one of the viewers. Let's wait for the technician to put it up on screen. All right, Samira Mangera says, my son is 8 years old, has been diagnosed with neurogenic bladder. He uses the catheter. The doctor says he has to use it for the rest of his life. Is there no other way?
Yeah, we touched on this point here about especially in patients with spinal disease, neurogenic bladder in this particular case. For those for the viewers who refer to where there's a compromise in terms of the nerve supply to the bladder, and it would involve things like the sensation of feeling the bladder and also the motor function, where the bladder muscle would contract and allow the urine to be expelled. So someone with a neurogenic bladder may lose both of those functional aspects, right? So as the mom is mentioning here, that her child has to use a catheter to empty the bladder because the child is unable to do it themselves, you know. So they've got to artificially insert the catheter through the urethra and gets to the bladder and drain the bladder out. I mean, look, obviously, I don't know the full details of what she's saying, but I mean, if the mom is mentioning now that it's a neurogenic bladder, and she was now told that they need to catheterize, unfortunately, in majority of cases where there's a diagnosis of a neurogenic bladder, unfortunately, that is the only way. That's the only way, unfortunately. You know, one is to actually empty the bladder. You know, there are other surgical techniques that one can do, you know, where one sort of creates like a catheterizable stoma on the abdominal wall, that the child or the individual will then put the catheter into that point into the bladder and then drain the bladder like that. So in other words, not going via the genital area, like in this case, in the male would be via the penile area, the urethra. So that requires a surgical procedure where you can create like an opening from the abdominal wall into the bladder, through which, again, but a catheter still has to be used to empty the bladder. But those kind of things are also fraught with complications. You know, there can be issues with that. There can be strictures. There can be a situation where some of the child may not be able to get into that point, and then the bladder just expands and they can't empty their bladder. So you know, I would say that if this is what they've indicated to them, then that's probably, you know, the best solution. Also, just on a point about that, just for the mother's benefit, and I'm sure they must have explained this to her already. By using a catheter intermittently, meaning every 3-4 hours, whatever schedule they're following, where the child is not emptying the bladder, it's still a better situation than having an indwelling catheter inside all the time. That means to make sure the bladder stays empty. So if the child has been adequately trained, or the parents know how to do it, and they've acquired the ability, alhamdulillah, that's a good thing. You know, often whenever you see patients like this, when you literally tell them that's what they need to do, it's almost an impossibility. You know, they feel like, how am I ever going to get this right? How will my child ever be able to do this? But, you know, it's amazing how the human mind and human body is so resilient, especially children. And then they're able to understand, they're able to acquire the skill, able to do it themselves in most cases, And if they can accomplish that, I think one should accept that, instead of exposing one to major operations that have also potential complications.
True, man. Such a painful process there. Oh, we just had another question up on screen, and it seems to have disappeared. All right. Oh, there. Habiba asks, does a kidney infection always present with a fever? I had a bladder kidney infection, and the only symptom I had was pain.
Yeah. So again, it's not an absolute. Remember, it doesn't mean that 100% of the time every single patient will have all of the symptoms. In medicine, we describe a symptom complex. It's a variety of possibilities, maybe a mixture of one or two, maybe all, maybe none. So yeah, so it's not to say that every single kidney infection has to have fever. No, that's not what I'm saying either. It's a possibility, it's a constellation of symptoms, right? But commonly, one would that would alert one that there's a problem. Because remember, if somebody had, for example, let's say a bladder infection, and maybe it wasn't adequately treated or they didn't have any treatment for it, and then it complicates. That will happen a couple of days down the line. In that time, the infection is now brewing, there's some changes that are taking place. And one of the early signs will happen where the body is now responding to that sort of strain on the urological system. And one of the features that will come about would be a fever, which would suggest to us that now the body's in overdrive, the body's trying to arrest some sort of focus of infection, or there's some fight happening inside your body now, and that's registered by the fever. So it's a very important sign. That would make the clinician a bit more concerned, rather than in most cases people with fever and infection, we say, no, we need to admit you to hospital, perhaps we require intravenous antibiotics, to that extent. So we would use it for one, a diagnosis, and also to prognosticate the patient's outcome, and also it may determine the extent of how we want to treat.
All right, let's quickly go through the diagnosis and the treatment involved. I see we don't have much time, but let's do our best.
Okay, so obviously quickly, so the diagnosis one obviously would be symptoms, right? So past history, symptoms, as I always say before, the clinical examination, what do you find? Is there swelling of the kidney? Does the patient have a stone? Is there a blockage of the kidney? We will test the urine, do a laboratory analysis of the urine, which will also confirm a potential infection. We also can rely on ultrasound, CT scan to give us an indication. Is that kidney compromised? Is it swollen? Is it infected? The blood test also guide us. High infective markers, high values that suggest that there's some heightened activity in the body. So those are some of the modalities you would use to diagnose. The treatment obviously requires antibiotics. When we send a urine sample to the lab, if there's a specific bug in the urine, the lab will be able to give us a culture, tell us, okay, this is a specific bacteria that is in this individual, and also will suggest a possible option of treatment, which kind of antibiotics are likely to eradicate the infection. So the clinician will decide, the urologist will decide, or the physician will decide what combination of treatment is required. So for complicated infections, we often use like a combination of antibiotics. Some we cover the patient for bacterial infection, for fungal infection. It may vary. So remember, every individual is different. Based on what we find in that individual, it's going to determine how we're going to go about it. But to summarize, the treatment would be antibiotic treatments, and it would be pain medication. And if there's an anatomical abnormality, let's say, for example, the patient got a blocked kidney, then you can't just simply treat the patient with antibiotics. One is to now go and unblock the kidney, maybe remove the stone, or relieve the blockage of the kidney, or if the patient can't urinate, put a catheter for them to drain their bladder out. So that additional measure has to be done also in conjunction, with the antibiotics or whatever other medication is now being used to manage that situation. And obviously, the blood test and the blood markers and the urine tests are also used for us to evaluate how the patient is responding to our treatment. If they come into hospital and they've got high infective markers, once we start the treatment, one way we can tell whether the patient is responding to our treatment is by re-looking at those blood tests, seeing what kind of response we're getting. Are the markers coming down? Are they getting worse? Is the kidney function improving? Is the patient feeling better? You know what I mean? So it's over a couple of days that one's going to monitor the situation, see how is it going to go. Do we need to add some other treatment? Do we need to change the antibiotics? It's a dynamic process, and you'll find that the clinicians are looking at certain parameters daily that would help them to decide how to manage the situation.
All right. Last question from one of our viewers. What happens if the a bug returns, but in a different form? Sometimes these bugs are different, and they what's that word that I'm looking for?
They will change the
they would change. Yes, they would become different or stronger.
Yeah, that can happen. So, that's why I say when we send a urine sample to the lab, let's say there's a bacteria in the urine. The lab will be able to identify the bacteria by name, some fancy name you'll get from the lab. Okay. Let's say a patient comes back again a couple of months later, another infection. Now, we would be very curious to ask ourselves the question, does this patient have the same bacteria as previously, or is it something? So if, for example, let's say it's the same bacteria, the same name, the same structure all the time, that would suggest to us that there's some focus in that individual's urinary tract. It's the same focus.
Oh, seems like we have lost Dr. Salim over there. Not to worry. We were discussing kidney infection, and if you have any further questions, please leave them in the comments section, and we will try to get a doctor to answer them. You can also send them to us on WhatsApp. The number is 061 766 0355, and we will also share doctor's contact details should you require it over WhatsApp. It is 11:35. You are listening to the Mid Morning Talk on Salam Media with me, Mari Mokwanda. Please stay with us. We will be right back.